Hi, everybody. My name is Richard. I'm here today to present on my concept map related to Barrett's theory of power as knowing participation and change. This theory was developed by Elizabeth Ann Barrett and focused on allowing patients to understand that through learning about their uh, freedom of power, that they are able to become aware of their situation, have choices in that situation, uh, have the freedom to act, and then be actively involved in that change that they need to have in their lives. In this particular case here, in my concept map, I decided to focus on the nurse's role in empowering a patient through the dying process. My experience with patients in this instance has been that there are many facets of dying that can be confusing and cause a lot of anxiety. Through Barrett's theory, I feel that I would be able to better assist patients through this process. So Barrett's premise is that there is definitely a difference between power as control and power as freedom. Many of us are familiar with power as control. It is how we see power a lot of times when we view it in the framework of money or politics, or even in our daily lives, as it's seen as a way to manipulate situations into what someone wants to get out of it. The difference here is that as people understand the power of freedom, they start to learn that the power can be used in a way that instead of them feeling controlled, they can feel freedom in terms of uh, being able to have a say in what it is that's going on with them. And in this case here with the dying process, you could see in my map that I have four main focuses that I have seen in the past with other patients. The first one I want to focus on is on the physical condition. As nurses, we try to educate patients through assessment and um, conversations about what it is that's going on with them. There's definitely a lot that happens physically with someone as they are dying. As you can see off of that, I have overall decline, mentation, and pain. So when someone's dying, a lot of times they will get to that point where they are no longer able to understand or make decisions about what it is that's going on, and that can be scary. So if we allow them to have that understanding that they can have power uh, and of deciding now what it is that's going to happen with them, that will allow them to have that freedom. So a lot of times it's about making plans about what it is, advanced directives, but oftentimes it's when you're getting to that end, what is it that you want to happen? And one of those things would be with pain, right? A lot of times there might be pain involved in that process. When someone starts taking a lot of the medications that are involved with that, that can compromise their mentation sometimes. But also there are other ways that we can help them deal with their pain is through imagery or some other uh, manners through therapeutic touch, massage. These things can really help mitigate pain as well and allow people to have more freedom as they're moving through that process. And also having comfort interventions involved with the overall decline in terms of their just all the processes in their body, not just being able to perform ADLs, but also just their organs kind of shutting down and that sort of creating a situation that they feel like they're losing control. But at the same time, if they understand what the process is, they have the freedom of understanding what it is that's happening next. The next piece I have on here is about regrets. A lot of times, patients will have regrets about what's happened to them, uh, sometimes with relationships, with their family members that can kind of come up to the surface, their unfulfilled dreams, or also just their what ifs. What if I had made a different decision? Would I be here now? So really, our role as nurse is to listen, to have empathy for the resident, and also if we're able to let them understand that power of freedom, they don't have to like live in that regret. They can know that they are in a situation that will allow them to make some decisions that maybe they can feel better about those situations. And then there's loss, right? And we can allow patients to feel empowered instead of disempowered when it's coming to that situation of losing their control, losing their visions of the future. Um, there are many ways that we can uh, help them deal with that if they understand that it's not necessarily a loss of power in terms of control, but that they have freedom in making some decisions that will help them feel better about those things. And finally, I have the fear of the unknown. As we sit back and see that happening in our patients through active listening, we're able to understand what it is that's going on with them. Um, a lot of times, the fear of the unknown will lead to anxiety, loneliness, and then wondering what it is that's going to happen to them next after they pass away. Um, I think that if we let them understand that they have that power of freedom and be able to connect with them in terms of easing their anxiety, maybe through some medication, um, our presence allowing them to understand that they're not alone in that moment, and then also understanding where they are spiritually. Some conversations can happen about what it is that happens next in terms of moving on to wherever it is that they feel or have an understanding of. So I feel like this is a very pertinent area that this theory can have some influence on. This. Here you can see I have a quick outline of Barrett's theory. You can see here on the graphic on the side that the framework is based in Rogers' science of unitary human beingness theory. You can see at the top here the postulates and the principles are definitely right from that theory. And then she builds from that theory at that point, and starts to focus on her premise as power is freedom. And when she talks about power is freedom, she's talking about that awareness, the choice, the freedom to act intentionally, and the involvement in creating that change. And she makes a very clear distinction here how there's in the causality world, we're really focusing on power as control, taking that power and manipulating situations to get to the outcomes that we're looking for, as opposed to power as freedom. Really, that's more about understanding that we can use our power to change the moment without having to understand what the outcome is going to be. And that's a very clear and strong distinction that she tries to make as she develops this theory. Also, she developed a tool called the Power as Knowing Participation in Change tool. With that tool, she's able to develop a power profile that shows the weaknesses and strengths that the individual might have in terms of that power as freedom. And then based on that profile, there are some applications to the theory where she's asking in that pattern manifestation, knowing and appreciation, she's really just asking the patient, what is it that you want? What is it that you're looking for at that point? And then moving on to the voluntary mutual patterning, where they're actually asking the patient, where is it that you see yourself in your life right now? That way they have the starting point and maybe a goal of where it is that they want to sort of try to move towards, but it's also always remembering that it's the intention of moving towards something without having to know exactly where it is that you're going to end up. And then also moving on to the health patterning and the health patterning modalities and the power prescriptions. So there we're um, enabling or empowering the patient to enact that power as freedom through some techniques such as imagery, dream interpretation, therapeutic touch, ways that they can sort of uh, raise that power inside them to manifest those changes. Here is my reference page. Thank you, everybody, for listening. I hope you got something out of this.